Do you know which is the third most common cancer in the United States? It's colon cancer, and by 2030, it has been estimated to be the leading source of cancer death in adults under 50. Therefore, it's critically important to know about the warning signs of cancer to get it checked before it's too late. That's what we are going to witness in this video. But first, don't forget to subscribe our channel and hit the bell icon. Number 1. Constipation. The majority of people struggle with constipation because they do not consume sufficient amounts of fiber or water on a regular basis. However, chronic constipation, which lasts for more than a few weeks, is thought to be an early indicator of colon cancer. Stool elimination becomes particularly challenging as a result of the tumor that is located at the very end of the colon. If you experience any kind of obstruction, it is vital for you to get checked out as soon as possible. Number 2. Bleeding from the rectum. If you notice blood in your stools, this could be an indication that you have colon or stomach cancer. The color of the blood can range from bright red to dark maroon. If you notice blood coming from your rectum, you should get checked out to determine the precise cause of the problem. More than half of those who have colon cancer experience bleeding from the rectum. Number 3. Entrail urges. Going to the bathroom to defecate or urinate, and then finding that you cannot satisfy your urge to defecate after you have finished, may be a symptom of colon cancer. Clogging of the gut, also known as gut inclinations, is a specific form of constipation that makes it difficult to release stool. So to put it simply, gut inclinations are when you have the urge to defecate many times a day or have a bowel movement. But when you do either of those things, you don't feel satisfied and you have the sensation that you really want to go again. People with sickness in their distant colon or rectum, where malignant growth generates enlarged stress in the interior, typically struggle with gut urges. Number 4. Stomach pain. Due to the fact that colon disease irritates the lining of the digestive tract, which is where malignant formation starts, certain people have stomach pain and a feeling of being squeezed. The presence of cramping and stomach pain does not necessarily indicate that a person has colon disease, because these symptoms can also be caused by other conditions, such as infectious diseases and inflammatory conditions. Patients diagnosed with colon cancer may or may not experience any stomach cramping or anguish during their course of treatment. People experiencing stomach cramps, mild or severe, and constant flatulence should consult a doctor, because these symptoms may be an early warning sign of colon disease. An investigation by the Canadian Cancer Society directed expresses that stomach pain can originate from numerous diseases. People should be aware of their bodies and be on the lookout for anything that seems out of the ordinary. They should consult a medical professional if they have issues that are persistent and ongoing, such as sharp pain in the abdominal region from stomach discomfort, gas, and an uncomfortable feeling of fullness or bulging. Number 5. A feeling of unsteadiness, weakness, or exhaustion. Experiencing weakness, tiredness, or unsteadiness, colon illness, can be indicated by the presence of these symptoms. Because colon disease can sometimes create drainage in the digestive organs, which can lead to continued drainage after some time and may cause you to feel sick, especially if the disease has been present for a while. A sudden pale complexion is synonymous with press insufficiency, which can frequently leave you feeling exhausted, fragile, and worn out. Colon illness is not the only type of malignant growth that can leave you feeling weak, depleted, and feeble. It's just the most common one. Number 6. Stool that is almost black and tarry. Having stools that are dark in color or seem like tar should prompt a visit to a medical professional, because these symptoms frequently point to the presence of colon cancer. When there is drainage higher up in your colon, your stool may appear tarry or weak due to the fact that the blood has the time to separate from the feces before it leaves your body. This can cause your stool to have a dark appearance. It's possible that your stomach, other tiny digestive organs, or esophagus are draining, which could cause your feces to be dull and slow. Number 7. Gas and bloating. If you always feel a little crampy, it could be a sign of colon cancer. Even though bloating and gas are common, if the problem lasts for a long time, it could be a sign of something more serious. Tumors can stop the body from getting rid of gas, which causes bloating. Therefore, it is recommended to not ignore this warning sign. Number 8. Feeling sick or like throwing up. Feeling sick or throwing up is also very common. Sometimes you have a sudden urge to throw up whatever you ate for breakfast. Some people also say that they have problems with acidity because of the way they throw up. But if it happens often, you should go to the doctor right away. Number 9. Weight loss, loss of appetite, and feeling weak for no reason. Losing weight, losing your appetite, or feeling weak can be signs of colon or rectal cancer, as well as many other conditions. People who have diarrhea all the time can lose weight. Stomach pain and nausea can make you less hungry, so you don't eat as much as you need to stay the same weight. Patients with colon or rectal cancer often have all these symptoms and must be examined at once. Number 10. Anemia. Anemia is a disease of the blood that is caused by not having enough red blood cells or hemoglobin. Anemia can be caused by intestinal bleeding in people with colon or rectal cancer. Depending on where the bleeding is happening in the colon, anemia can be the first sign of blood loss. People with anemia often have pale skin, a faster heartbeat, tiredness, dizziness, and periods that don't come on time. So if you are experiencing any of these symptoms, do not ignore them, since these signs could be a warning that you have colon cancer. What could be the risk factors? Number 1. Family history. There are signs that colon cancer runs in families. The American Cancer Society says that 1 in 3 people who get colon cancer has had it in their family. Talk to your doctor if someone in your family has had adenomatous polyps or colon cancer. You may need to start screening before age 50. Number 2. Age. As you age, your chance of getting colon cancer goes up. It can happen to people under 50, but it does so much more often after that age. Number 3. Being overweight or obese. Both men and women are more likely to get colon cancer if they are overweight, but the link seems to be stronger in men. Number 4. Sedentary lifestyle. Colon cancer is more likely to happen to people who don't work out than to people who do. Number 5. Diet. Colorectal cancer is more likely to happen if you eat a lot of red and/or processed meats. It's not clear if other parts of your diet, like the kinds of fats you eat, affects your risk of colorectal cancer. Number 6. Smoking. Cigarette or tobacco smoke is reported to contain 70 carcinogens and is known to cause many types of cancers, including lung cancer and colon cancer. Number 7. A lot of alcohol use. Drinking alcohol has also been found linked with colon cancer. Men shouldn't drink more than 2 drinks a day, and women shouldn't drink more than 1 drink a day. This could be good for your health in many ways, including lowering your risk of many types of cancer, including colon cancer. Thank you for watching and subscribing our channel. See you in the next video.